Okay, I'm going to go ahead here, and my portion is to talk about the methodology of diagnosing CNS disease from a practitioner's perspective. And just to start out, CNS diseases in the U.S. swine population are fairly common, especially in the nursery. And when I first thought about what things that I immediately jumped to my head when I think about CNS diseases in the nursery, I came up with this list. The main infectious causes that I think of right away would be bacterial meningitis, whether it be from strep or Haemophilus parasuis, and then things like edema disease from enterotoxigenic E. coli. Non-infectious causes, probably the number one thing would be salt poisoning or water deprivation. There are toxicities. I added ionophore toxicities in there now that there is an approved ionophore for swine, and knowing that its reaction with thiamulin could be something that we see as a differential in the future. And then there are nutritional deficiencies that lead to CNS disease in nursery. But I'm not up here to start listing every reason why there could be CNS diseases in swine. What I want to do more is kind of tell you how I go about diagnosing central nervous system disorder in nursery pigs and the things that I look for when doing so. So went to Iowa State to vet school, and I bet I heard hundreds of times from different professors, when you're in North America and you hear hoofbeats, it's probably horses and not zebras, which is true, but I think that it's important to establish a routine when you're going through and investigating cases so that if an occasional zebra runs by, you don't miss it. So when I was thinking how to describe the way that I go through a case and I analyze a case, I came back to the old SOAP principle, which still pains me to talk about today, even 5 years from vet school. But it was something I didn't enjoy doing, but I find myself mentally going through this process when I go through cases and go through barns, and it is helpful to kind of walk through that in describing what I do when looking at cases. So on the subjective part, what I first do is I gather relevant history, and sometimes that's done on the phone on the way to the farm, talking to the producer, but that includes client observations, insights, and concerns. I think those are important. It's a lot easier for me to do my job and get a correct diagnosis if I have the caretaker involved, because they know their pigs better than anybody. When I go on that site, a lot of times, depending on my relationship with the client, it may just be a point in time, real quick glimpse of what's going on, whereas they have the full picture. They're the ones that started identifying that there was a problem. So key questions that I ask, there's a whole slew of questions. Some of the things I ask are, how long has this been going on? Are you losing pigs? Is there mortality associated with your concern? If so, is it a chronic or is it a good pig that you're seeing die? Have you treated them yet? And if so, what's the response? Do you think that they're responding to treatment? And then I ask things like, what are you treating with? How often are you using it? And things like that. A lot of those, I spend a lot of time in this process interviewing the caretaker, because this is where a lot of the things will come out that I may not pick up on just walking through the barn. And I'm also not too proud to welcome their opinions and hunches, because once again, a lot of times they'll already have an idea of what could be going on, and they may be right. So it's always good, I think, to use them to your advantage, and it helps a lot to come to a good diagnosis. In the objective stage, I identify and characterize problems. So that would be clinical signs or observations. I always get in the pen. If you walk through the alleyway, I've noticed many times where pigs may look normal. You don't see a whole lot of stuff, but say like in a strep meningitis case, you get in the pen, you start stirring the pigs up, and you start noticing that there's a pig that's just a little bit off, is acting a little disoriented that you wouldn't have noticed from the alleyway. So I usually make a point of always walking through the pens, and then always asking myself, what am I hearing, what am I seeing, and what am I smelling? There are things that, like hemolytic E. coli will sometimes smell distinct and can help you also come up with a conclusion or a diagnosis. Then I like to estimate percent morbidity. So I walk through the pens. In my mind, I'm thinking, okay, what percent are we dealing with here? Is it 1% of the pigs? Is it 5%? I'm going to treat the case very differently if it's 1% versus 5%. And so that's something that I always like to kind of, in my mind, get my arms around. I also like to evaluate the environment, because we know that humidity, stressors, like if you're chilling pigs or creating drafts, those can all add to the problem and maybe even be a reason for the problem. And so I like to do that. And then I use records to tie it all together. And if you're fortunate and they have good records, that can be another big piece to the puzzle. So I look at things like how many pigs have died in the last 7 days, how many pigs have they treated in the last 7 days, and how does that compare to what they were treating up to that point. And then, like I said, again, treatment choice, frequency, and dosage. Something that I've noticed more on finishing sites than nursery, but even if they come to me and say, I just am not getting the response I expected from an antibiotic, and I've assessed the case, and I think it's like a bacterial meningitis or a bacterial pneumonia, and it's just not really making sense why they're not seeing a response. Sometimes if you start digging and you look at calibration of the medicator, you look at length of needle, you'll find that the needle length maybe isn't long enough and they're getting sub-Q, not IM. And so there's things like that that also require investigation that can sometimes be a reason why the product is not working like you think it should. During the assessment phase, mentally, during this whole process, I'm collating the information in my mind. What did I see? How does it all fit together? Does it make sense, every piece that I'm trying to put into the puzzle? And then I develop a differential list. And very rare is it clean cut. It's usually 2 or 3 things sometimes that are going together to create a problem. And so I try to just make my differential list and rank them as to what I think is the main cause of the problem that we're seeing. Sometimes I'll take diagnostics, but other times, based on the clinical assessment, maybe posting some pigs, I can come up with a pretty good diagnosis and feel confident about it. If I'm going to take diagnostics, I want to make sure I take a lot of time to select the right animals, and I'll maybe even take marking spray in the pen with me, and when I'm walking through the pens, and I'll mark a pig here or there, and then I'll pick the 2 or 3 best pigs that I see that are not chronic pigs and not real acute pigs, but pigs that are kind of in the middle and representative of the problem. If there's only a couple pigs that are staggering or showing CNS signs and that's not representative of the population, I don't take those or focus on those. I always talk about when you're doing a CNS case, you want brain and you probably want histopath on the brain. So you have to make sure that you have a euthanasia method that you can use that does not destroy that tissue so that you can get good, accurate histopath from it. And then swab meninges prior to removing the brain, because a lot of times once you send that brain into the diagnostic lab, they'll sear the surface to swab inside, and then any of that bacteria that was on the meninges might be lost. So I always try to do those things when I'm working up a CNS case. So when you leave the farm, you can't just say, well, we'll see what diagnostics say in a few days. Until then, just hang tight. You got to come up with something there, and you got to make a decision on what you're going to have them do. In central nervous system cases that I think are bacterial in nature, I'll often use an antibiotic. If it's a large percentage of the population, we'll do an oral treatment, and we'll also focus on injectable treatments for those that are very acutely affected. And then we'll do things like anti-inflammatories to try to help with the edema on the brain that's causing some of those clinical signs. The follow-up, I think, is one of the most important pieces to any investigation, and it's one that is often overlooked, and I'm guilty of that too. I always think, well, I'll leave the farm, didn't really hear from them, it probably is, no news is good news. But every once in a while, when I do get a chance to follow up and I try to make a point to, I'll have producers say, well, that neomycin, yeah, it started working after about 4 days, and the looseness was going away. Well, in their mind, the neomycin did the job. In my mind, I'm thinking, I would have expected it to work faster. It probably is just natural course of disease and a viral enteritis. And so that helps me next time when I assess those pigs, or in another case to learn from my experiences and maybe do something different next time. So I'm going to go into a couple cases. The first case, it was a 2,000 head nursery in south central Minnesota. There were 400 or 500 head rooms, and they were filling it from the source sow farm 1 room a week. And so it was a really slow fill time, but it was all out. So they'd bring the pigs in about 5 weeks post-placement. They'd move them out to a finisher. So they were between 5 and 9 weeks once they got in the finisher. They were 17 to 21 days of age at weaning and PRRS positive at the time. 10 to 14 days post-placement, they called me and said something really strange is going on. We have pigs that just are acting disoriented. Some are down and paddling, their eyes are bulging, there's something weird, you gotta come check this out. So I came out there, and the pigs were displaying a lot of clinical signs of central nervous system disease. They were circling, some of them were paddling on their sides, they were even chomping, some of them would lick the wall. I mean, right away I was thinking this could be a water deprivation case, it was pretty severe, and it was pretty rapid in nature, and to the point where, they weren't seeing any response to treatments, and it was just rapidly occurring. At one point, it got as high as 25% mortality per room. When I walked through, I saw very little cough, or no cough, and very little looseness, and there was normal activity despite the pigs that were down on their sides paddling and the other ones that were kind of disoriented. Other nursery sites with the same source of pigs, all of them were doing fine. 1 to 2% mortality, no clinical signs, very healthy and active pigs. So right away my differential was strep meningitis. And like I said, I thought about water deprivation, and in the back of my mind I thought, well, maybe this could be a sudden onset of an edema disease type thing. Like I said before, they were unresponsive to injectable treatments commonly used to treat strep, and so that was kind of making me concerned that maybe we weren't dealing with a bacterial meningitis. So I right away euthanized several pigs. They had been aggressive with spot treating before I got there, so it was hard to find some untreated ones, but I was able to include some of those. And I submitted a full set of fresh and fixed tissues, which included brain and brain swabs. And then I shipped overnight to Iowa State. And I got the diagnostic report back, and the results showed PRRS, which I knew. And then there was a hemolytic E. coli F18 with a STX2E toxin, which was a nasty edema disease bug. So the susceptibility chart didn't make me feel much better. We had basically 2 options, and neither one of them they had tried some Exceed right up front, and just wasn't a lot of options for us to pick from. So kind of fast forwarding, this problem occurred off and on for 2 years, and it got to be very, very difficult for us to try to find something that would get the E. coli knocked out of them and keep it knocked out of them. Some turns would be better than others depending on the intervention, but ultimately they still would see higher than normal mortality, probably between 5 to 25% depending on the turn. I would periodically resubmit diagnostics because I kept thinking, this is just getting ridiculous. There must be something else here. And every time I'd come back with edema disease. And so, again, all the other nurseries were doing fine. And so we had come to the conclusion that it was this barn, and there was something with this barn and some reason why we weren't getting it out of the environment. The interventions are literally too numerous to include, and I would challenge someone to ask something that I didn't try. If there was an article out there about edema disease, I've read it. We tried everything, and they were very cooperative, which was kind of fun because, they wanted to get rid of it as bad as I did. And we tried antibiotic interventions. We tried acidifying the water. We did intense cleanup procedures, including fumigation, which we'd see maybe one turn that would be a little better, but ultimately it would always come back. There was just numerous things, extended downtime. At one point they even took all the gates off and cut off the bottom angle iron and redid their gating. And bottom line was nothing worked. And so in our desperation, we were getting ready to surrender and getting to the point where we were discussing, not using that nursery anymore as a nursery. We were talking about, maybe using it for a GDU or a finisher. Once again, it was a fully slatted barn. And in the past, I had talked to them before about what if we sealed the cement floors with a cement sealer, and they didn't really think that was probably something we wanted to try. But then we got more and more desperate, and so they ended up trying it as one last intervention. The owner said, I'm going to go up to the concrete supplier uptown or the concrete place, and I'm going to get some sealer. And he did it. He washed and disinfected the room, let it dry, and then applied 2 coats of the cement sealer with a roller brush. And bottom line is we haven't diagnosed hemolytic E. coli there since 2012. So he's down to 3 to 4% death loss, there's still things to work on there. It's just, thankfully, it's not hemolytic E. coli anymore that we're dealing with. So the conclusion to this case is I don't know for sure what it was that solved the problem. I have a partner that always likes to remind me that it's the last thing you try that always works. And in this case, the last thing that we tried was the cement sealer, and so I have to think that had something to do with the reason why it went away. But I think it was probably a combination of the downtime, all the interventions that we tried. And it was, like I said, multifactorial, and the lesson here was that we persisted over a number of years sometimes to fix a problem. This is a rare case. Luckily, I don't have cases where we battle this for this long, but it required thinking outside the box and trying some things that I didn't even personally have a lot of confidence in that ended up helping us, I think. So case number 2 happens to be the same client. So here we go again. This was just a couple months ago. They had one of the most severe PRRS breaks I have experienced in June and July. The end of June, they broke with PRRS, 12% sow mortality, really very severe. And this nursery received the first pigs, the pigs at the peak of the PRRS break at the sow farm. They originally filled it with 1,600 pigs because the sow farm was not producing because of their pre-wean mortality. And then about 4 weeks post-placement, they called me and said, well, we've battled through the PRRS, we've had to euthanize a lot of pigs, and so we're at 25% death loss. The pigs kind of seem like they've been taken off and they're kind of over it. But all of a sudden, they started seeing these CNS signs. And so they called me up at that point because something had changed. They thought, we're going backwards again here. So I went in there, and they had about 3 to 4 new pigs per day displaying central nervous system signs out of 1,200, and they were described as pigs starting to sway and lose balance. So I went through the site, looked again at the pigs, and yeah, there were several pigs that were down and paddling. They had rapid deterioration again despite antibiotic use, and in this case they hadn't pulsed any antibiotics through the water for 10 days. So I had a nice start here. I didn't have any. I had a nice sample, I guess, for diagnostics. I didn't have a lot of antibiotic use going on. This pig was a pig I chose to sample because it was representative of the population. There's proprioceptive deficits. There's a fixed gaze. He's trembling. His ears are erect. He was the one that I chose for my sample. And they were rough looking because they had gone through PRRS, but he was a relatively good pig, I'd say, out of the population. Not one that I would say was a chronic pig, and they said he had been normal the day before, so it was pretty rapid in progression. So I took tissues from this pig and another pig that was found dead, and I submitted tissues. So I found when I posted them, there was heavy wet lungs and large bronchial lymph nodes. I knew they had PRRS, and so that fit, but I didn't really see anything in the gut. My differentials obviously were hemolytic E. coli because we dealt with it in the past, and then also strep. And so I said, well, because it's so severe and it's not responding to antibiotics, let's see if we can find something else. And so I sent off a complete set of tissues again, along with the brain. And at the time, to fit with the strep, we had to do something. So we said, let's try some oral amoxicillin and treat with penicillin and dexamethasone to try to see if we can't do something while we're waiting for diagnostics. So the diagnostic report came back. Dr. Madsen was on this case. And the histopath came back. Brain had inflammatory changes that were multiple and severe. There was no bacteriology, no growth on lung or brain. And then what really threw me off was down here, he says PRRS, okay. But then they talk about PRRS meningitis, which is he thought was the case or the cause of the CNS signs. And so I actually called him last week and I said, is this for real? I've never seen this and I don't really know what to think about this. And he said, yeah, actually it has been documented and those lesions were what you would classify as PRRS meningitis. And so here he ended up forwarding me 2 papers from Dr. Rousseau that described PRRS meningoencephalitis in neonatal pigs. And then the second article described PRRS lesions that were affecting the brain and talked about how it was possible that PRRS, or it was documented that PRRS can replicate in glial cells of the brain. So that wasn't even on my differential list, something brand new to me. When I followed up with the client, they had continued to treat with broad-spectrum injectable antibiotics and dexamethasone to try to help with any of the swelling on the brain and to just try to do anything. They continued to develop new cases over the next several days, and then it kind of just went away. But they probably did lose 2% in the long run. And the interesting thing is the CT value was relatively high on those pigs. And so the PRRS infection was, relatively mild, but we still saw these signs from that infection. So in summary, It's important to keep an open mind. Down and paddling is not always strep. That's why I chose 2 cases that weren't strep, just because I wanted to talk about something different. It's important, I think, that we develop a routine when we investigate cases and that we stick to it so we don't miss things. If you don't take tissues, if you don't further investigate, sometimes you just assume that it's something and it ends up being completely different. And then again, follow-up is often overlooked, but I think a really valuable piece of the puzzle, because without that, we aren't learning from the decisions we're making or becoming better at what we do.